This video is for support only. Tollos recommends all users receive hands-on training by our clinical resource specialist prior to use and refer to the detailed reference guide for application process. Tollos recommends 1 to 2 caregivers when operating the lift. Please consult your facility's policy and procedures to determine how many caregivers are required. This is the Tollos Walking Sling. The walking sling is designed to be used with patients having difficulty ambulating or are at risk for falls. It is ideal in an inpatient rehabilitation setting for gait training, as well as acute care and long-term settings. It is important to note that the sling is intended for patients who can actively participate in achieving a standing position and who can support their own weight. The walking sling is designed for use with ceiling lifts with a track system that allows for height adjustment, versatility, and freedom of movement. However, mobile floor lifts can be used but may not be suitable for tall patients. The walking sling can be used with a 2, 4, or 6-point spreader bar. The walking sling is available in small, medium, large, and extra large with a weight capacity of 660 pounds, as well as an XXL with a weight capacity of 1,100 pounds. The walking sling can be applied in sitting or standing from the front, or in reverse. The choice of front or reverse application will be at the discretion of the caregiver and the patient. It will depend on the individual circumstances and personal preference. Once the Velcro belt is attached, place the support webbing straps over the patient's shoulders as shown. To hook up the sling, thread one of the security webbing straps into the most available O-ring on the belt. Then insert that same webbing strap through the sling O-ring on the opposite side. Repeat the process with the other security webbing straps using the same O-ring on the belt. To apply the leg straps, click one end of the leg strap to the back receiving buckle on the sling and lean the patient slightly to the side. The leg strap should be under each leg as shown. Buckle the front end of the leg strap to the receiving buckle. Adjustments to leg straps will be made once the patient is standing. Attach the sling to a spreader bar by placing the support webbing shoulder straps to the center spreader bar hooks. Then attach the security webbing strap to the front set or back set of hooks on the bar, depending on which way the sling was applied to the patient. Next, instruct the patient to stand, making sure the spreader bar stays clear of the patient's head. Adjust the spreader bar as needed for comfort. Tighten the leg straps as needed to allow support. The sling can provide assistance as needed for the sit-to-stand movement, but remember, the patient should always be able to support their own weight. Once standing, the patient should be able to ambulate as able. A therapist can provide facilitation as needed. When using a mobile lift, a second person is required to assist with the lift.